Welcome to the Cervical Cancer Survivor Series. I'm Martha Kempner with the American Sexual Health Association and the National Cervical Cancer Coalition. We recently reached out to survivors across the country to hear their stories of diagnosis, treatment, and survivorship, and get their advice for others whose lives are impacted by this preventable disease. We also talked to providers in the field to answer questions about screening, prevention, and treatment. In this final episode, we hear from all of our survivors from this series: Jen English, Shaundra Hall, Aisha McClellan, Selena Rushton, and Cheryla Thompson. We asked them about a wide range of topics, including the advice they've received and would offer others after a diagnosis, how friends and family can best support somebody going through cancer treatment, and what they would say to anyone who was considering the HPV vaccine. We also asked why they decided to become advocates. The first question we asked was, what was the best piece of advice you were given when you were diagnosed? Let's hear from Selena, Aisha, Shaundra, Jen, and Cheryla.
I think the best piece of advice I received when I was diagnosed was from my internist, was to go contact the 4 closest people in my life to frame me up and shore me up with support. She actually gave me another one too, which was, I don't get to feel like a hypochondriac. I am not my symptoms. My symptoms are merely there to guide me to get care, and I need to be listening to those.
The best piece of advice that I was given when I was diagnosed was to not focus on statistics and numbers, and understanding that everybody is different. Every body is different. You don't know how you're going to respond to a particular treatment versus somebody else, and just finding ways to understand that your path is different and it's unlike no other. And so just not getting caught up in comparisons was a big one for me.
The best piece of advice I got when I was first diagnosed was not to eat my favorite foods, because I wanted to enjoy them after I was done with treatment. And if I ate all my favorite foods throughout treatment, and then once treatment concluded, there was a chance that those favorite foods would no longer bring me that kind of joy, because they would take me back to when I was going through treatment. And so I did avoid my favorite foods, and I still love them to this day. So that advice did work for me.
I would say that the best advice I was given was to just relax and not think too hard about it. And I don't know that I actually took that advice, because it's hard when you feel like you have this foreign substance in your body and you're freaking out, not to overthink about it. But I think that was probably the best advice I wish I had taken.
The best piece of advice that someone gave me when I had cancer was, it's going to get better.
We also wanted to know what advice they would give to someone who was just diagnosed. Now we'll hear from Aisha, Cheryla, Selena, and Shaundra.
Take time to process what's happening. And, it's okay to be upset. It's okay to go through all the emotions, but try to find a place of grounding yourself and not think of the worst case scenario. Try to think of what the best case scenario is, and then live your life according to that versus worst case.
I never say to somebody that's not going to be hard. Like at the beginning, when they come in, like, oh my God, what is it going to be? Am I going to be sick? Am I going to be this? And I'm going to say, it's going to be hard. And, just to feel that, as I say, monster inside. So I tell them that from the beginning. And then I share with them that I am a survivor and that it did come back again, back in 2019. So I tell them that sometimes, the monster may try to come back, but you just got to keep on fighting.
One of the things I've learned the most that I'd like to share about my journey myself is how much more I needed to know about myself, both physically, emotionally, spiritually. This journey takes work. It takes listening. It takes everything to pull through, and nobody can do it for you. It's really difficult to expect anyone to understand what you're going through, because they're so busy going through their own things, and they only have the limited information they have about themselves. They're not in the same place facing the same things you are. And that's okay. Just remember, it's your journey. no one else's.
I do not have a piece of advice that I give other people other than do your homework and learn about your disease. You're not expected to know as much as the professionals do, the professional providers, but it does help when you understand the mechanisms of your cancer. If you are going to do any sort of homework and research on your own, only do so from reputable sources. Do not look up fringe organizations. Go to the National Institutes of Health. Go to American Cancer Society. Go to the American Sexual Health Association website. Go to National Cervical Cancer Coalition website. Go to the national websites, because that way you can have confidence that the information that you are consuming is accurate. And they have a lot of support services as well.
Our survivors shared what they wish they'd known about cervical cancer before they were diagnosed. Let's listen to Jen, Shaundra, Aisha, and Cheryla.
Probably everything. That's a hard answer because you can never know everything, but I felt a little in the dark about both. Like, what's this mean for me? Where is this going to take me? Does this mean I'm for sure, with HPV, am I for sure going to get cervical cancer? Like, do I need to start doing something because of that? All of those questions, I wish there would have been someone to answer those.
I'm not saying my provider did not mention it to me, but I was in such a fog that I was just like, get the cancer out, get the cancer out. I was just I had tunnel vision, get it out, get it out, get it out. Knowing what I know now, I could have had my eggs harvested, and then we could have had a biological child together using a gestational carrier.
There's nothing wrong with you. It's highly stigmatized because it's associated with sex. Most people have had sex. And if you've ever had sex, even if it's been one time, you are susceptible to get HPV. Literally, one person, one time, you can get HPV. It affects over 80% of the population. And so what I wish I would have known is that it's so common. HPV is common, which causes cervical cancer, but don't fear having these conversations, because the more we talk about cervical cancer, the less stigmatized it's going to be. I just want people to understand it's not a result of like what you've done wrong.
When I was diagnosed with cervical cancer, I knew absolutely nothing about it. And that's one of the things that I always share, that with breast cancer, we all know about breast cancer. Everybody, even a 9-year-old, knows that October is breast cancer month. Cervical cancer, we hear nothing about it. You know why? Because it's the embarrassing cancer. 1, because of where it is, and 2, because it's a sexually transmitted disease. And because of that, nobody wants to discuss it. And I think that is one of the most scary things about anybody who has it, that they don't really want to talk about it. To get rid of that stigma, I think the only thing we can do is to keep doing what we're doing.
Next, we asked what advice they have for friends and family of someone who was recently diagnosed. Here's what Cheryla, Shaundra, and Aisha had to say.
I would tell the family member to be understanding, to have empathy, to understand that it's going to take time, and just be positive and work with them.
The best thing for someone to do to help someone who's been diagnosed is to tell them they're there to listen. Don't tell them, oh, I had an aunt that died from that. Oh, my cousin had that and she passed away. Oh, I heard that you get that because of you've done XYZ in your life. Don't say those things. Say, I'm here. If you want to talk about it, we'll talk about it. I will listen. If you don't want to talk about it, we don't have to talk about it, because not everybody wants to share. There's a reason why people don't disclose critical health journeys. It's because all too often, when we get diagnosed with cancer in particular, we go from being the patient to being the caregiver, because we're trying to console you, because you're having a hard time processing this information and how it affects you most of the time. So just be present, listen. If you want to do something nice, chores.
I would say don't ask, because for me, like, And for a lot of people, we don't want to feel like a burden. We don't want to feel like we're asking you to overextend yourself. So think about things that you can do that you don't have to like ask permission to. Like everybody needs a warm meal, like bring dinner or bring support or just share ways that you want to like help on your own without having to ask that permission. Because I think a lot of times like people might have asked me, but I didn't want to seem like anybody else's burden. If it's okay, like just go by and check on them or bring them some dinner or offer to help them in ways that they might not normally ask you.
We asked what these survivors would have to say to someone considering the HPV vaccine. Here's what Cheryla, Jen, Selena, and Shaundra would tell them.
I would say to someone who wanted to or was considering getting their children the HPV vaccine to go do it. It's important because we don't know what's in the child's future. It's something that's not going to hurt them. And I think that we should all give it to our children if we can. Anything that could prevent something, we need to help them prevent it.
What would I say to someone thinking of getting the HPV vaccine for themselves or someone else? I would say that seems like a no-brainer. Absolutely get that done. It's like a second of needle in your arm for knowing that, or, feeling more secure and knowing that you most likely won't get cervical cancer because of that. I have 2 teenage boys and a 13-year-old girl, and I'm pretty sure all 3 of them just got their HPV shots. They hurt a little bit. They complained, and I was like, well, sorry. And I remember saying to them too, I said, well, I'm really sorry that hurt. I understand that it hurts, but it hurts way less than having cancer later. And that's how I got cancer. This is going to prevent you from getting that cancer that I just had.
If you're thinking about getting the HPV vaccine, I'm going to support you. I think that's fantastic. If you're between the ages of 9 and 12, you're thinking about getting it for your child, recognize currently they'll need 2 doses. For yourself, if you're the parent, the auntie, the grandma, someone else under age 45, male or female, you're going to need 3 doses. Just do it. Don't put it off.
What I have to say about the HPV vaccine is you don't expect to get in a car wreck when you leave your driveway, and yet you still put on your seatbelt. So the HPV vaccine is your seatbelt against anogenital cancers, head and neck cancers, genital warts, warts on your hands, warts on your feet. I mean, why wouldn't you, if you have the best interest of the health of your loved ones, why wouldn't you ensure that yourself, your family are all vaccinated? The research is there, the results are there, it is safe, it is effective. And why wouldn't you want to keep your loved ones from getting cancer? It's just a no-brainer.
Finally, Jen and Selena share why they decided to become chapter leaders for the National Cervical Cancer Coalition.
God wouldn't have given me cervical cancer if he didn't think that I could do something with it. So it's my job to use my platform to speak for those who maybe are not willing to speak, don't know how to speak, have no idea what they're even talking about because no one has told them. So I'm just hoping to be able to use my platform to inform people.
What made me want to become an advocate is recognizing that I just was. I was already sitting in waiting rooms talking to people or looking at the faces of people that looked so lost and scared and didn't recognize if they went 1 floor below, they could go to an education center, or if they reached out across the room and looked at a poster, they could see support groups exist for like everyone for anything. I realized that I just couldn't be quiet. I had so much to say, and I had to learn what I was saying and why I was saying it and who I hoped would listen to me or not. But I just realized that's who I was.
Thank you so much for listening. If you haven't already, we encourage you to listen to the other episodes in this series, where you can hear the full stories of these survivors and learn more about cervical cancer prevention from healthcare providers Barbara Moshitsky and Brad Monk. You can find all of the episodes, along with other information and resources, at the website of the National Cervical Cancer Coalition, at www.nccc-online.org.